Uh, Hi, everybody. Good morning, good afternoon, good evening, wherever you might be. Thank you for signing on. My name is Key Park. I'm the director of the Korea Health Policy Project. And our team here, we're a number of researchers with on-the-ground experience within North Korea. And our research is that we do has have a purpose. It's to inform the broader public as well as policymakers on what's actually happening inside DPRK in terms of health and what's been changing since the pandemic, and what are some of the things that we should know about and consider as we develop a policy around re-engaging with DPRK. So today, we had a first webinar about a month ago. There's a recording of it. We can share the link to that. That was more of a high-level overview of the DPRK's health system. And today we're going to talk about the DPRK's response to the COVID pandemic, which really which gives outsiders an idea of how the North Koreans think about protecting themselves in times of a global public health emergency like a pandemic. And then there'll be two more. One is in about a month from now. The schedule should be posted. We'll share it on the chat as well. But the next one is about North Korea's current priorities in terms of what they're buying, importing medical and health supplies and equipment. And the last one in April is really a discussion about what do we think, and what do some of the other experts think about the landscape and some of the frameworks that may be necessary for re-engaging North Korea in health. So today, the session on the North Korea's management of COVID is moderated by David Hong, as another senior researcher with the Korea Health Policy Project. And David, let me turn it over to you.
David, please
David,
unmute yourself, please.
Oops, sorry. Good morning, everybody. It's 9 a.m. here in East Coast time. Not sure where everybody's joining from, but thank you for joining us today. We're excited to be presenting this research information for you. Just a reminder, again, we're doing a four-part series on Korea's international health engagement. This is second of our four-part series. The next session will be March 25th, again at 9 a.m. on a Tuesday, and we'll be addressing what import data reveals about North Korea's health priorities. Session 4 will be on April 22nd at 9 a.m. for a new era of public health engagement with North Korea. Thank you again to all our partners. We are co-sponsoring this event with the National Committee on North Korea, the Council of Korean Americans, the Stimson Center vis-a-vis 38 North, and United States Institute of Peace, as well as the Harvard Program in Global Surgery and Social Change, and our organization, the Children of Korea, a medical mission organization dedicated to helping Korean Peninsula. So again, we're honored today to have our speakers. Our first speaker is Yoonhee Ryder. She's currently a ENT resident, otolaryngology resident at the University of Michigan. She has a dual degree in biology and anthropology from the University of Alabama in Birmingham. And Yoonhee has also served in the Peace Corps as a volunteer in Togo for 2.5 years, serving the Community Health Extension program before starting medical school at the University of Michigan. She joined the Korea Health Policy Project while she was a medical student and has been dedicated to helping us since then. And she is specifically interested in analyzing the trends in Chinese customs data, as well as analyzing the effects of COVID on the North Korean health outcomes. Yoonhee is very active in the field of global surgery. In fact, she's transitioning on her way towards the East Asia to help a global surgery project. And we'll be presenting and summarizing our prior research today on COVID-19 in North Korea. Our discussant today will be Martin Williams, who is a senior fellow with the Stimson Center. Stimson Center's 38 North program. He follows North Korean technology, media, and the economy. During 2022, he maintained the North Korean COVID tracker that catalogs state media disclosure on the spread of COVID in the country, and we're honored to be featuring today as our discussant. So we'll do about 15-20 minutes with Uni presenting. Martin will follow with another 15 minutes of discussion, and then he'll be presenting his data, and then we'll take maybe 10 to 15 minutes for questions at the end. So please feel free to use the raise the hand function or ask comments in the chat. And we look forward to the content today. So we could start with Uni.
All right, awesome. Let me share my slides here. Does everyone see my slides? We're good? Okay, wonderful. So thank you so much for that introduction, Dr. Hong. Really grateful for the opportunity to be able to discuss today some of the research that myself, as well as several members of the Korea Health Policy Project, have worked on over the course of the pandemic, and just honored to be here to be able to present for our second webinar for this 4-part webinar series. Right. So today we're going to be discussing 4 different articles that were written by KHPP members. So the first, we're going to be discussing the vaccination or capability of a vaccination campaign against COVID-19 in North Korea. Second, we're going to be discussing how North Korea managed its COVID-19 outbreak back in 2022. And then once the outbreak ended, we're going to be looking at what lessons can be learned from China's zero COVID policy and how they can be applied to North Korea's COVID-19 containment approach and border closure. And then lastly, we're going to be taking a deep dive looking specifically at the data that North Korea released during their COVID-19 outbreak in 2022. So the first article we're going to be discussing is looking at capability of a COVID-19 vaccination campaign in North Korea. And just to give some context about when this article was written, it was written in August of 2021. And at that time, it was more of the beginning of the pandemic, and there had not been yet any offers of vaccines to North Korea. And there was a perception going around in the international community that the DPRK didn't have the capability or infrastructure in order to be able to do a mass vaccination campaign against COVID-19. And so this article really challenged that perception by providing both historical evidence as well as firsthand evidence by some of our members in KHPP and was able to lay out kind of a framework or a roadmap for a possible vaccination campaign and how that could be feasibly done. So just to give some historical perspective, historically, North Korea has shown that it's capable of mass vaccination campaigns and mobilizing people quickly. So for example, during the measles epidemic in March of 2007, they were able to vaccinate an average of 3.3 million people per day, which if you think about it is an astronomical number of people and requires a lot of organization. And then this graph that you see here shows some historical perspective of a standard childhood vaccination, the diphtheria, tetanus, toxoid, and pertussis vaccine, going from 1980 to 2013. And you can see in later years, especially, there's a great vaccination coverage rate, over 90%, thanks to partnerships between the DPRK Ministry of Public Health, UNICEF, and WHO with support from Gavi. You can also see here that the reported coverage matches the coverage survey results that they did kind of as a spot check with a provisional verification factor of 0.93, meaning that the reported data coming out of North Korea was reliable. So we're lucky to have Dr. Shafiq, who's on the call today as well, who has had experience working directly with the cold chain and vaccination campaigns in North Korea. And he took these photos documenting a working cold chain in North Korea. So typically, vaccines are first procured and then stored in the cold room. You can see on the left-hand side of this in Pyongyang. And then they're carried by cold trucks out to the provinces and village levels. There was concern at this time as well about the lack of steady electricity and whether or not that would compromise COVID-19 vaccines. And actually in 2003, there was a pilot program that gave about 50 solar refrigerators, which you can see on the right-hand side of this screen, to different county hygiene and anti-epidemic stations. And this pilot project was completed in 2004. And what was cool about this project is they actually trained technicians, North Korean technicians, on how to maintain these solar refrigerators. So if it needs to be used in a vaccination campaign against COVID-19, it could be fairly easily ramped up as there's already people trained in how to manage this technology. So here was our proposed vaccination distribution plan. So already, without really much additional infrastructure needed, the DPRK's national cold chain was capable of supporting a countrywide deployment of vaccines that require just standard refrigeration. So that's between 2 and 8 degrees Celsius. And these include AstraZeneca, Sinopharm, Sinovac vaccines. Some equipment may need repair or replacing, but the enhancements were expected to be minor at that time. The DPRK, what we also showed is that they could deploy mRNA vaccines as well, such as Pfizer, which requires a negative 70 degrees Celsius cold temperature for storage, as well as the Moderna, which requires negative 20. And so if there weren't deep freezers already, UNICEF, given its familiarity with North Korea's cold chain infrastructure, could likely quickly procure these and install them, these ultra cold freezers, to be able to store a limited quantity of vaccines. Another option as well is that if we use the Pfizer and Moderna vaccines within 30 days, you don't technically need the ultra cold freezers. You can store them in normal cold temperature refrigerators, which they already have. And given the historical knowledge that we have of their ability to distribute about 1 to 3 million vaccinations per day, this could feasibly be done in North Korea and be able to vaccinate a large proportion of their population. So far, there is no evidence that supports that North Korea has engaged in a mass vaccination campaign against COVID-19. So given that, let's talk about how North Korea appears to have managed its COVID-19 outbreak back in 2022. So just as a review, the first case of COVID, North Korea release was in May of 2022, so May 12th, and then they declared victory or said that their COVID epidemic or pandemic was done in August 10th of 2022, so within about 3 months. So at the beginning of the pandemic, there was a lot of concern that if COVID were to reach North Korea, it would be catastrophic for a variety of reasons. So first being that there's a relatively poor health infrastructure and capacity for critical care, such as ICU level settings, may be lacking. And there are medication shortages as well. And there hadn't been an effort, like we discussed, to vaccinate the population. And like other developing countries, malnutrition is also an issue. And whenever someone is malnourished, it can introduce an element of immunocompromise, making outcomes worse if you were to get COVID-19. There's also a perceived lack of epidemiological advanced technology, such as computer-based statistical modeling that could be useful in tracking and curtailing a mass epidemic if it were to reach North Korea. However, interestingly, although they had all of these kind of negative factors going against them, the COVID-19 pandemic that reached North Korea, at least from the data that was released by North Korea, was not catastrophic and was able to be contained within 3 months with a relatively low number of cases and relatively low number of deaths. So there are a variety of factors that we theorize that could have contributed to this. First, in North Korea, there's a strong focus on preventative care within the medical workforce. So in particular, in the physician workforce, the physicians are widely distributed and are assigned to specific households and workplaces. So this makes it very easy to do any type of surveillance or case tracking. Second, there's a limited geographic mobility of the North Korean population, both domestically and internationally, which for an airborne disease like COVID can be helpful. And then DPRK, as an authoritarian country, is able to mass mobilize resources and people very well, and we've seen this in the past with other prior epidemics, such as the measles epidemic. And lastly, the strain of COVID that reached North Korea was the Omicron variant, which is highly contagious but less deadly than the other variants that we saw earlier on in the pandemic. So now that the DPRK has announced that they had an end to their COVID cases, we wanted to see, they still are having a relatively border lockdown. It's better than it was in the earlier days of the pandemic. However, we wanted to see, kind of looking at China's zero COVID policy, what are the lessons that can be applied to North Korea's COVID policies? So when we look at kind of different priorities that different nations have in terms of how they manage the COVID-19 pandemic, it's all about balancing these priorities. So in China's case, they had to balance the morbidity and mortality of COVID versus the economy. So during their lockdown in 2022, particularly in Shanghai, during their lockdown, they had kind of economic devastation where they had an estimated loss of 46 billion US dollars. However, when they suddenly opened their border back in December of 2022, they had a massive spike in COVID-19 cases with up to 60,000 deaths in one day. So there's been multiple things that have been theorized to explain the massive increase in death, such as loss of natural immunity during the border, the close down of Shanghai and the strict kind of COVID policies, as well as low vaccination rates among the elderly in China, and potentially the low effectiveness compared to other types of vaccines of the Chinese vaccines. North Korea, similarly, is weighing similar different priorities. So they are weighing COVID, morbidity, and mortality against the economy as well. And then also looking at food insecurity and malnutrition by, with their border closure, not getting supplies for agriculture or food across the border as well, which can, if you have, as we discussed, malnourishment can lead to immunocompromise. So there has to be some way to be able to mitigate these different priorities and prevent both economic devastation and devastation from COVID-19. So countries like South Korea and Singapore, for example, were able to make quote unquote a soft landing where they were able to kind of loosen their COVID-19 policies but not have as many deaths, at least from the Omicron variant. Some of the ways that they did this is that their vaccination, most of their population was already vaccinated from previously in the pandemic, and they were well prepared in terms of their workforce, having gone through the first strain of COVID. However, China, with its strict zero COVID policy, had what we call a hard landing, meaning that they were kind of had a loss of immunity, potentially from loss of acquired immunity during the actual close down of cities, and potentially, as we discussed earlier, a lower vaccination rate among the elderly. And so what are ways that we can prevent North Korea from having this hard landing? And so you can see those in the green box. We can potentially do a vaccination campaign in Korea, as well as bolster their ICU and critical care personnel, training for personnel, as well as providing equipment. And in order to do this, it requires a long-term capacity building partnership with the North Korea Ministry of Public Health to be able to prevent this hard landing of COVID if they do end up opening their borders fully. So now let's take a closer look exactly at the data that was coming out of North Korea when they were reporting between May and August of 2022 to see if there's any interesting insights that can be gained. So this figure shows the new daily fever cases and the daily recovery cases in North Korea. Overall, the shape of the graph for new cases, which you can see in blue, and for new recovery cases, which you can see in orange, look about the same, but there's a time difference of 3 to 5 days. So this mirrors kind of expected epidemiological trends, as well as what we've seen globally with the COVID-19 pandemic. And interestingly, if you look at the timeline of the peak amount of COVID cases per province in North Korea, it gives you interesting insights. So you can see in the blue, these are provinces where their peak number of cases occurred after May 14th. And the red provinces are the provinces where their peak number of cases happened before May 14th. So you may notice that the red provinces are border provinces. We don't really know what we can theorize, but we don't really know what happened in Gangwon-do, the province bordering the South Korean border, although all we can do is analyze a pattern. But as we all know, it's almost impossible to think that COVID crossed across the South Korea-North Korea border, just given that there is very limited mobility across that border. So more likely, what happened is that COVID crossed from the Chinese border into North Korea. And there is some historical precedent for this, including the measles epidemic in 2006 and 2014, where it's hypothesized that that came over from across the Chinese border as well. It's also interesting to note that there are a couple of different things that we notice within the data. First, although at the beginning they were using COVID-19 cases in particular, they ended up switching to fever, which could suggest that there's lack of diagnostic technology within North Korea to actually identify true COVID-19 cases versus just generic cases of fever. Second, there were days where nothing was reported. There were no new cases that were reported, which epidemiologically doesn't quite make sense. And third, all the numbers were rounded to the nearest tenth. So they were all reported with numbers where it had a 0 at the end of them. And then there were some cases that were reported that didn't belong to a specific province. So this could potentially have belonged to or documenting cases among the military. And then if you look closely at the math, which I know Hee-jae, who's part of our KHPP team, really look closely at, if you look at the cumulative cases that were reported out of North Korea and then do the math yourself where you add up these cases, sometimes there was a discrepancy there as well. So what can be done? What do we learn about from this data? So one of the things that can be done is to provide more diagnostic equipment for COVID-19, given that it seems like there's a lack of diagnostic equipment, given that they've been just reporting fever cases, and as well as providing epidemiological support to North Korea and helping them better track cases in order to better contain a pandemic if it were to come back, if COVID-19 were to come back to North Korea. And this would require a partnership and working with the international community kind of with long-term capacity building. Okay. So these are the 4 articles that we discussed. So we discussed about COVID-19 capability in terms of vaccination. We also discussed the COVID-19 pandemic in North Korea, those 3 months between May and August of 2022, and what takeaways we can learn from China's zero COVID policy and how we can apply that to North Korea's policies. So thank you again for the opportunity to speak today. And as Dr. Hong mentioned, we have our next webinar in March, so hope to see everyone there. But now I will turn it over to the rest of our discussion today.
Great, thanks, Uni. So now we'll hear from Martin Williams, Senior Fellow at 38 North. The screen is yours.
Thank you very much, and good morning. Thanks for the invitation. I think during the introduction, Key said that one of the objectives of the program is to tell the world what's actually happening in North Korea. And when it comes to COVID, that's of course something we still don't really know because very few people have been back into the country, and there was so much. We had so many questions when the outbreak was going on there, but a lot of that has become clear now. The way that North Korea sort of dealt with COVID was, I think, unique because of some of the things it did, but also, as was just touched on, the structure of the country as well. So I'm going to talk a little bit more about that and a little bit more about some of the data that we had out of the country. So hopefully I can share my screen and we can get going with, North Korea was one of the first countries in the world to shut its borders to everybody. This wasn't a kind of border shutdown that we saw in most other countries where citizens or certain other classes of people could still travel. North Korea really shut its borders down. And I think the assumption with that, which we already heard about, was this perception internationally that it had a very poor public health system and it just wasn't able to deal with something like COVID. First of all, it stopped foreign tourists coming in, and then a couple of months later, it actually enacted a shutdown that stopped even citizens returning home. So for many years, North Korean citizens that happened to be overseas during the beginning of COVID were not permitted back into the country, and that only changed in the last sort of couple of years. I should note that foreign tourism is back in North Korea. Russians have gone back. And then just last week, the first Western group got into the Rason region, right up in the northeast corner of the country. So North Korea is cautiously reopening to groups of foreigners. There's obviously a little bit of politics in there as well in regards to current sort of Russian and Western relationships as well. But that is now starting to happen. Most of the diplomatic staff in Pyongyang left at the beginning of the lockdown, but a few did remain and they stuck it out. But after a while, most of them left. I think we all remember the diplomats leaving. These were Russian diplomats leaving on a handcart. At the time, this was a sort of indication of the border closure that North Korea enacted. It was so strict that they didn't want to even send these people on a train across the border because it would have meant either sending a train across and leaving it in Russia or bringing a train back from overseas. And it seemed they were very, very concerned with the possibilities of COVID coming in through any route. The other thing that the North Koreans really tried hard to do was shut down the Chinese border to illicit crossings. This is just sort of one of the satellite images we took in 2021 and 2022. A second border fence went in. A lot of new guard posts went in. They were very serious about stopping any sort of illicit traffic across the border, not just legitimate crossings at border posts. That has remained to this day, and that I think is going to be one of the long-lasting effects of the COVID outbreak in North Korea. It's not going to be a long-lasting health effect, but it's this securing of the border and increasing control of the population that during COVID they learned that they could do, and now they're continuing to put that into practice. Before North Korea announced its first COVID outbreak, there were several reports of COVID outbreaks in the country from unofficial sources. We don't know if how much of that was true or not, but at least if you believe some of the reports, COVID was circulating in very small amounts well before the pandemic began in May 2022. And some of the things that I think before we talk about how North Korea coped with COVID, some of the things that are worth mentioning and remembering, some of which we just heard, was that North Korea's public health system does reach across the entire country, but it is like most things in North Korea, it has a lot of issues with regards to the efficiency of the system, with regards to the equipment available, the drugs available. There are a lot of issues that it have, which I think was reflected in how much it tried to shut down the borders of the country to give it as much of a chance as possible to stop COVID coming in. There's also a continued reliance on traditional Korean medicine, most of which obviously would do little towards COVID. But there were some things going for it that other countries didn't have. And that was, you know, this idea of it being this authoritarian country. It was possible for them to very quickly ramp up things at a national level. There was also a lot of control already in the country. In a lot of places around the world, we started seeing additional COVID checks and even internal checks along borders and things like that. North Korea already had that. You know, if you were in one, especially one of the northern provinces, you couldn't get on a train and simply travel to Pyongyang. You had to get permission to make that trip before the pandemic. So this was something that North Koreans were already used to. The idea of, you know, infringements on freedom and liberty and that kind of thing with restrictions of travels was not an issue there because this was something that was day-to-day reality. Also, the ownership of personal cars was very low. So most of the travel that North Koreans did was around their village or around their town, and it was by bicycle or maybe bus. And there was not a lot of travel between provinces and even within provinces. So that was something that probably initially did a lot to delay the national spread of COVID inside the country. But that all changed on May the 13th, 2022, when North Korean TV sort of led with pictures of Kim Jong-un. We'd already seen earlier pictures of people masked up, so North Korea was very aware that COVID was a thing. They were taking precautions against it, but then things started changing. North Korean TV was covering the impacts of COVID overseas. These are from television news reports. The three images you can see there is actually of COVID testing and the effects of COVID in the United States. And North Korean television was talking about what was going on at the international level. So the population was aware of all of this that was happening. But then May 13th, which is when for the first time North Korean state media acknowledged an outbreak of COVID within the country. Even Kim Jong-un was wearing a mask in these pictures, which we hadn't seen up until this time. If you watch the entire report, then about halfway through, he does take the mask off because he wants a cigarette. And of course, he's the leader, so he can do that. And we did see subsequently in a lot of other events that often he would be pictured without a mask, but everybody else with him was wearing masks. But this was big news. This was the North Korean state for the first time acknowledging that there was a COVID outbreak in the country, and it appeared relatively serious. State TV said that the fever, as they were calling it, had explosively spread since April 2022, and already 350,000 people had gotten sick. This was on the first day of reporting. But on that day, it also said that 162,000 had already recovered. So this was already a relatively large outbreak before they went public. The sort of assumption, or the best theory, is that this outbreak had gone so fast and so widely that it spooked the state into a national lockdown, including Pyongyang, which then meant that it couldn't just be ignored anymore and they had to go on to report it. Yeah, as we heard, it was Omicron. The first time that state media announced this on the 13th, they announced 6 deaths. They said 1 had tested positive for Omicron. The others they didn't mention. And then after that, we just heard them talking about a fever. And yeah, the assumption is that they probably didn't have the testing capacity to go into that. This is what they said when they announced the news on May the 13th. So this got people, it's got people's attention because this was what had been assumed to be the worst case scenario for North Korea, was an outbreak in this country where they weren't perhaps very well prepared for it. So lockdowns were put into place. and the state propaganda went into overdrive, which is something else that North Korea has as an advantage. These are all posters telling people about all of the things that they need to do. This is my favorite one, asking if you're following the emergency quarantine regulations. Everything in North Korea is centrally controlled. So when the state, I think, decided that this was a emergency for the country, everything was in unison. The message that people were getting from their newspapers, from television, from posters on the street, from radio, from everything was telling them that they needed to do this. And this was a population that was also used to being controlled. So in many ways, it was the sort of opposite to a lot of what the West had to deal with, which was people rebelling against all of these messages. North Korea had an entire apparatus built around giving the population different messages, and also a population that had no way to sort of oppose it, a population that were used to following the rules of the government. So this lockdown was probably very successful. Checkpoints appeared throughout the country. These were, as I said, there were already checkpoints on roads between provinces and things like that, but anti-epidemic checkpoints started appearing. People's temperatures were checked as they were entering cities, especially Pyongyang. State television started broadcasting public service bulletins. This one is talking about some of the different drugs you can use to catch a fever. I think that is a bottle of paracetamol that she's holding up. And then what happened next was a surprising degree of transparency for North Koreans. They started showing a lot of what was going on television. You can see these are anti-epidemic workers. They would go along and spray the streets. And then in the bottom corner there, we see a doctor who was doing house calls on people, the pharmacy. And then these numbers that we started getting. We didn't expect to get numbers, but we got very detailed numbers that every night on television, and only on TV, not in the newspapers, but only on TV every night they started broadcasting these detailed portions of data, province by province, about the number of people that had been sickened, the number of people that had recovered, the number of active cases. And that was the COVID tracker that we built on the website that sort of followed what was going on. And the graph that we came up with looks very similar to a couple of graphs you just saw. This is the number of active cases. The number of active cases peaked, I think, on May the 19th at 755,000. And then it gradually fell. There was a small blip around May 29th. But after that peak, it gradually fell until North Korea declared victory against COVID. The number of deaths, more interestingly, very, very low. By the end of the outbreak, 2.5 million people had been infected or sort of come down to fever, however we're describing this. But the number of deaths was only was very small. It was only I can't find it in my notes here, but it was only about 40 or 50 people. It also peaked before the number of cases did. And this was one of the sort of biggest questions that came out of all of the data that North Korea was sharing. On the one hand, the data was very, very specific, as you can see on this chart here. It was province by province. It was down to individual numbers. It was coming out daily. It was looking like it was correct. The number of recoveries was following by about 5 days that we just heard. But the number of deaths, it peaked before the number of cases. And then it was very, very low. So either North Korea was very successful or there was something going on in this data. Of course, we still don't know what. 74 was the number of deaths. Sorry, I just found it. 74 deaths out of 4.7 million people that had been sickened. So I think if this number of deaths is indeed incorrect, there are two possibilities. Either the central government decided to start downplaying deaths because it didn't want to spook people, Although on the other hand, all of the other imagery going out must have frightened people, as I think it did all around the world when these pandemic began. The people in the suits, the people walking around spraying things down, the lockdowns, all of the extra control, the constant messaging about how to stay healthy. So perhaps the number of deaths wasn't played down centrally, but I think it's quite possible that maybe at the local level, leaders were understating some of this to save getting excess scrutiny from Pyongyang. The way this worked, it seemed, was that people were visiting homes in each village and each town every day to take a sort of daily census, and that was being reported up to the provincial level. It was then going to Pyongyang. So I think if there is some sort of manipulation of the data, perhaps it was going on at that local level rather than at the national level. But at least until now, we don't know. The long-term effects of this on COVID, on North Korea, certainly we've been seeing a sort of continued focus on building up the medical infrastructure. There are new hospitals under construction, but some of that we would have expected anyway. I'm sure North Korea is much better prepared in case there is a future pandemic, having gone through this, as probably a lot of countries are. But then there are a lot of effects that have taken place with regards to this lockdown. When North Korea basically closed its borders for 3 to 4 years, it really managed to do something that it had never sort of tried to do, but always wanted to do, which was be mostly self-reliant. A lot of the imports from China stopped. There was some products still coming in, but a lot of that stopped. The control ramped up. And I think North Korea realized that it can actually get along quite fine without a lot of the stuff that it had otherwise been used to. And that will be one of the long-term effects, is sort of increased control on the North Korean people and increased harsh conditions at the border. And the border is somewhere where either for just sort of general products coming in, but also medical products, a lot of the stuff that's smuggled into the country does come across that border, and it's now increasingly difficult for people to do that. So I'm gonna stop there, and we can jump into the questions and maybe discuss some of this. And I'd love to hear if you have any thoughts or theories about the sort of number of deaths peaking well before the cases did and things like that.
Thanks very much, Martin. That's super informative, very interesting information there. Well, we'll transition into questions here just to try to kick it off. One thing I'm curious to hear from your point of view, and something we're all trying to guess in the community, is what do you think is still motivating the ongoing border closure from North Korea, and how much do you think COVID might be playing a part in that? I think you kind of suggested what your answer might be in your most recent comments, but please let us know what you think.
Yeah, I think there's still, if they were still very, very worried about COVID, I don't think they would have allowed foreign tourists into the country. I think probably much more of the border control at the moment is to do with just control of illicit goods and control of information. North Korea's been battling that for 2 decades. And I think for the first time, it realized that actually it is possible to stamp this out. It had always been impossible in the past because of all of the bribery. But now there's 2 fences along the border. So you're not just finding one border guard you can bribe, you have to find 2 that are in the same place. There's more technology at the border. There's CCTV along there now, which started going up during COVID, which wasn't there before. I think one of the things that I said gave the state an advantage was this complete control of information. There was no Twitter. There was no one tweeting or discussing about freedom or about how it was fake news and things like that. But information does come in from overseas, and North Korea's been trying to stamp that out for years, and I think it succeeded in doing that during COVID in a way that it hadn't done before. So it wants to keep that as much as possible. That's not to say the border control is at the same level. Some things are now flowing across the border again. It seems to sort of ebb and flow depending on crackdowns and things like that. But yeah, I think if COVID was still a massive issue, we wouldn't be seeing foreign tourists come in. There'd be a lot more stricter about who they were allowing into the country.
Yeah. Yeah, by that same token, do you see in terms of imports and technology and things like that, foreign components of technology still entering country, and or a suggestion that how much they're kind of open to this idea of foreign engagement with in particular it's going to be China and Russia at this point.
Yeah, I mean, a couple of things. So North Korea did, when I say they closed the border, but some trade did continue, particularly coming by ship into Nampo. What we saw was that ships would often be held for 2 to 3 weeks before they entered the port. Presumably this was to sort of give chance to disinfect or, sterilize or, kill anything that was in any of this foreign goods that were coming in. Also up in the north of the country, stuff was allowed in by rail, and then it was taken to a military airfield that was converted into a sort of quarantine center, and the goods were put out onto the runway for about 2 or 3 months before they moved into the country. So some stuff was coming in, and that was the official imports, which would have been some of the more important sort of technology pieces that the government brought in. That continued during COVID. And today, a lot of the quarantine, the military airfield is back to being an airfield. Stuff is coming in now regularly. It's a lot of the smuggling of stuff that has stopped. I think North Korea is still very interested in engaging at the international level, and especially when it comes to healthcare. They did build this large hospital that was completed structurally. It appears to be complete at the end of, I think, 2019, right at the beginning of COVID. It never, ever opened. Massive hospital in the middle of Pyongyang during a, international health emergency, sat there unused. The assumption is that they weren't able to get equipment, so they can build the hospital, they've got the concrete, they've got all of that stuff, they've got the paint. What they don't have is a lot of the advanced medical equipment. And that is the reason why we think this hospital has never opened. They seem to be interested in opening it. It's a big hospital. If they were open to discussions and something could be done to help them with that hospital, because that will improve the sort of general medical condition in the country.
Great. So let's, there was a question in the chat, Davian, could you elaborate on the role that China played in Korea's pandemic response and what trends you've seen in medical imports or trade with China, and whether that has fundamentally changed since the pandemic? I don't know, do you want to try to tackle that, or Martin?
I will just say this is a great I guess advertisement for our next webinar as well, where we're going to be talking a lot about this and talking specifically about the Chinese custom trends across the border during the pandemic.
Martin, do you have any thoughts?
Yeah, I mean, not much to add. North Korea was offered COVID vaccines. It was offered help. I think at the time it did just seem very, very scared about bringing things in from overseas. During the beginning of the pandemic, I think we were all worried about that, right? We were all sort of disinfecting our mail and stuff like that until we figured out that wasn't actually that big of a deal. North Korea still continued to seem to want to do that. So I think that probably would have affected at least a lot of the kind of vaccine and drug response, because as we heard about the cold chain and things like that, you can't have a lot of this stuff just kind of like sitting on an airfield for 3 months in a cargo container. Yeah, I don't know whether anything was ever confirmed. I'm not sure.
Yeah, so I think there was a lot of discussion about North Korea not wanting to participate with Chinese vaccination options or the global options that were being discussed. I think we did see maybe broadly that there was a lot of imports in terms of masks and some PPE and things like that, but it didn't. I wouldn't really say that they played a large part in North Korea's response, but again, we're just kind of surmising from the outside. Hall Healy has a question. Uni mentioned the role played by WHO and other international organizations in the DPRK in dealing with COVID. What do you predict for the future now that those organizations apparently aren't in the DPRK? And the U.S. now having withdrawn from WHO, yeah. So major concerns here going forward. Either of you want to tackle that one?
I don't know the level of the current discussions. The international community is slowly returning to Pyongyang. So I would expect the WHO to return at some point. The question is whether it'll be this year or next year or even later. But yeah, I suspect they're probably quite high on the list of who North Korea wants to let in next. But I don't have an update from them.
Yeah, Key, you dropped a comment. Key, do you want to just weigh in briefly?
Yeah, I just put in the on the chat. I don't know if you are not following the conversation in the chat, it's really helpful. So the DPRK is serving in the executive committee of the WHO, along with ROK, by the way. They both are on the executive board. And their meeting just took place just a couple of weeks ago in Geneva, and there was a delegation of Ministry of Public Health officials. So they're actively involved, and they were commenting on almost every issue. But to your point, Hall, the WHO has not returned their international staff to Pyongyang. But I think the expectation is that they will be returning eventually. Nobody knows when that's going to happen.
Yeah, thanks, Key. I just want to return to the subject of the deaths spiking before the cases spiked in North Korea, and it's an interesting point there, and I wonder really what happened. And unfortunately, of course, none of us will really know the details, but my initial suspicion is maybe that in the U.S. we're criticized a lot for over labeling the number of deaths as being responsible by COVID. And I wonder maybe the North Koreans took the opposite approach and were super strict about what they might classify as a COVID related death. And then so once they kind of started to see the spike, then they've kind of tapered off. Well, that wasn't COVID. And maybe they kind of changed their attitude. But I'd love to hear what other people have to think about that. And in the meantime, maybe Keith, do you want to ask your question?
Thanks, David. Great program today. Martin, excellent overview in terms of the security aspects of the border, et cetera. Along the way, in recent times, we keep hearing from a variety of sources that while the security apparatus within the North is quite steadfast in keeping the lid on, that there is increasing pushback from medical health professionals within North Korea, that in fact the border should be opened or at least the restrictions lessened so that more humanitarian / medical / development assistance could get into the country. Martin, for you or Key or anyone else, any sense to the degree that what is the level of frustration of the medical professionals within the North regarding the continued border situation?
Maybe Key, do you have any idea about that?
Well, this is a really good question, Keith. Always challenging. I mean, I just this is a recorded session, so maybe we can talk about that more privately. Mainly because I don't think that there is there's a climate where you can voice frustration. And I'll stop there.
Great. Thanks, Keith, for your question. Let me just look around the room here. I don't see other people participating. Sorry, other people raising their hands. So yeah, I think there's a lot to look forward to in these coming months with changes on the ongoing border closures on the North Korean side and changes in the WHO with the U.S. and the Trump administration coming in here and starting to put their plan into full play here. So I think it'll be a lot of change on the horizon. And so I think hearing from our experts has been really helpful for us. I'll just share briefly again our flyer here for the group just to remind everyone. So we're looking at March 25th for our next date of webinar, and we can discuss some of the import data that we obtained from reviewing some of the Chinese records. And then we'll just kind of talk with everyone, see what their thoughts are on what the new era of health engagement will be with North Korea and how we can move forward as a international community. So we just have a few more minutes, see if other questions have shown up in the meantime. Any final comments, Martin, Uni, Key, do you want to weigh in?
Uni, Martin?
Yeah, I don't know. It's something that, hopefully in the next few years we can get some of these questions answered that we have, and not just because they've been in our heads for the last few years and we haven't been able to figure out what's going on, but also so that in the future, maybe we can give better aid or sort of help North Korea in doing whatever it feels is necessary to deal with future pandemics and things like that. But yeah, I think that's the end of my comments.
Yeah, interesting era ahead of us. So we're a couple minutes short here of 10 o'clock, but I think we can probably wrap it up here at this point. So thanks again to all our co-sponsors, National Committee of North Korea, Council of Korean Americans, U.S. Institute of Peace, 38 North, Harvard Program on Global Surgery and Social Change, and Children of Korea. Hopefully we'll see you all again on March 25th at 9 a.m. And we'll be posting a link for this webinar series for those who couldn't attend on our YouTube channel in coming days here. Thanks, everybody.